Welcome and thanks for joining us. My guest today is Dr. Niteesh Bharara, physiatrist and director of regenerative medicine at Virginia Spine Institute. So, doctor, the first thing we want to get into is really pretty basic for you, but for the average person, they're probably wondering, what is regenerative medicine? It's not a term you hear often when it comes to the world of medicine. So if you could please explain to all of us, in simple terms, if you could, exactly what is regenerative medicine? What is it that you do?
Regenerative medicine is where we use the body's own tissue to heal itself. I tap into the blood and stem cells of the patient to supercharge that healing process. This is a non-surgical treatment and has a minimal recovery time.
And how is it possible for the body to heal itself exactly? If the body can heal itself, then what's the point of anyone ever getting surgery?
Well, when you have an injury, there's a healing process that happens, but the body is only capable of taking the healing so far. What we do with regenerative medicine is we maximize that healing process so that your body is able to fully heal. But this only works for certain injuries. The more severe the injury is, the less likely it is to be healed with regenerative medicine. And then this will require surgery.
And you said you use stem cells, is that right?
That's correct.
Okay, and how does that process work? I know that many of us have heard about stem cells and procedures involving stem cells, but if someone goes into your office and they have an injury that's chronic, they need help with it, what is the first step for you treating that person?
When you come in the office, we will start with a consultation. We get a history, and then we lay out a treatment plan. I then decide whether we will use your blood or stem cells for healing. On your next appointment, we will then draw blood or collect the bone marrow. From there, we will take and separate the blood and get something called growth factors from the blood. Or we will separate the bone marrow and get the stem cells from there. We then take those elements and we precisely place it back into the area of the injury. And this is where we supercharge the healing process and the pain relief occurs.
So when you do that, what actually happens at the site of the injury itself? When you start to help a patient in this particular way, explain what it is that happens at the site of the injury that can create a bit of relief and maybe even a bit of a healing. I suppose it would be healing. What happens at the site of the injury exactly?
When you have an injury, it normally heals by itself. But when you have chronic pain, that's an injury that has never healed properly. So when we use a regenerative medicine procedure, we're looking to get that chronic injury that's never healed to actually heal. So we will restart the healing process and place either a growth factor from the blood there or a stem cell there to provide it with a better environment and make sure that it actually heals.
Okay, so you are actually using this technique to heal people. It's not just to deal with chronic injury. It is to heal, correct?
That's correct. We're not looking to just treat pain. We want this to be long lasting. We're looking to fix the problem and fix the injury.
And that leads into something I wanted to ask you, because when you initially hear about regenerative medicine, you hear about dealing with chronic pain. And what comes to mind as an alternative to surgery would be something like acupuncture. So if someone hears about regenerative medicine being a useful tool to combat chronic pain, and they think about something like acupuncture, can you help us decipher what the difference is between something like acupuncture, an alternative, and what you do, regenerative medicine? It's not the same thing.
No, it's not similar to acupuncture at all, actually. In acupuncture, you're looking to treat the pain, but you're not treating the underlying injury. With regenerative medicine, we're actually looking to treat and fix the problem. And in this, we relieve pain and get them back to living again.
So for the average patient who may be considering surgery or is told by someone they need surgery, when in fact regenerative medicine is an option for them and they don't really know it, can you explain to them and explain to all of us, is regenerative medicine a more complex process than going the traditional route of surgery and things like that?
Regenerative medicine is a very complicated process, while we deliver the treatment. But for the patient, it's actually a very easy process. They come in the office and we perform the procedure and they're out of the office within 2 hours. It's a very, very easy process for them, and it's a very short recovery time when you compare it to surgery.
What in your mind is a good example of an injury or chronic pain, anything like that? What is a good example for you of someone who would have really a lot of benefit from using regenerative medicine as a means for treatment? Is there one thing that stands out in your mind as maybe a perfect candidate, or is there a variety of different ailments you can think of? Lay out for us exactly what you think would be a good candidate for regenerative medicine.
Regenerative medicine can help a variety of different conditions. This can be the normal patient that has some lower back pain for years. They can benefit from regenerative medicine. Somebody with arthritis or a muscular tear, a rotator cuff injury, a painful disc in their spine. These are all different diagnoses that potentially could benefit from regenerative medicine. The more severe the injury, the less likely regenerative medicine can be helpful, but we have been able to help many patients with very severe injuries get back to doing everything they want to do in their life.
Can you think of a good example without revealing too much patient information, obviously? Can you think of a good example of someone you have been able to help in this way and get their life back on track?
There's one patient that comes to mind. This patient was a Marine Special Forces, a triathlete, a weightlifter. He was extremely active, but all that activity actually ruined his body. When he came to me, he could hardly walk, and he was in pain for the last 7 years, and it was just getting worse. We came up with a treatment plan. We did 3 rounds of stem cell therapy on him, and now he's training to climb Denali. He's back to living a full and functional life, and he didn't undergo any surgery.
Can you explain how it feels to receive the treatment that you provide? It's not surgery, so it's, I would imagine, maybe less painful, less recovery time, or maybe there's no recovery time at all. Can you explain how it feels in the process for your average patient?
When the patient comes in the office after we come up with a treatment plan, we either collect their bone marrow or we draw their blood. We then precisely place the element of either the growth factors or stem cells exactly where we want it, using some type of image guidance like ultrasound, fluoroscopy. The actual process is not very painful to the patient. They're able to leave the 2 hours and they're able to walk out of here. The recovery time is usually either a few days to a couple of weeks. So it's much, much easier than something like surgery.
And how can regenerative medicine change someone's life for the better? We touched on some of the conditions that you're able to treat, but if you could give us a broad overview of someone out there who has never heard of this and they hear you talk about it, what would you say to them as far as how this can be used to change their life for the better?
There's a gap in treatment between physical therapy and surgery. And there's plenty of patients that live in this gap. These patients have chronic pain and are now have been on opiates for many years. Regenerative medicine can go in and fix that problem and give the patient their life back. They're able to do the things they want to do again because they can naturally fix the problem.
And you can't go to just any doctor for this. If you hear the term regenerative medicine, you need to be careful about who you go to. You are a specialist. Explain why it is so important for patients to know exactly who they're going to and their credentials, and explain to people why it's really, really critical that they just don't go to just any doctor.
You need to see a doctor who has done many of these procedures, somebody who knows what they're doing and is very experienced in doing it. There's always a risk and there's potential complications when somebody doesn't really know what they're doing. So it's really important that you make sure you go to a place that specializes in regenerative medicine and talk to them about why they want to treat you with regenerative medicine. And I really think it's always important to get a second opinion.
And how hard is it to find specialists like yourself? Is this a widespread thing, regenerative medicine, or is it just in its early stages?
Well, regenerative medicine right now is not very widespread, but it is becoming much more mainstream and much more widely accepted because we're finally seeing the potential of regenerative medicine and we're seeing its success.
And if we could just wrap up by, we did touch on some of this, but it's so important, especially as you said, because many people are taking opioids. It's a massive crisis in the country and has been for years now. If someone has chronic pain, if they're a good candidate for regenerative medicine, what would you say to that person exactly? And how should they reach out to you or reach out to other specialists? Just basic advice for someone who you believe would be a good candidate for regenerative medicine and could really benefit from it. What would you say to them?
There are many patients that are on chronic opioid therapies because they don't have any other options. They've either had surgery or they're not a surgical candidate anymore. So their only option to get some sort of relief is pain medication. These are the patients that do very well with regenerative medicine. When they come in the office, we need to find out why they're in so much pain. And once we find out why they're in so much pain, we can then use different regenerative medicine techniques to actually go in the cause of their pain so that they don't have to just cover their pain up with a pain medication or a different treatment like acupuncture. This will actually treat the underlying problem so they don't need all that other stuff.
And in the end, their life really can change. It's important to manage expectations, especially with chronic pain. But if all goes according to plan and you have a successful outcome, their life really can change.
This can absolutely change the life of these type of patients. Chronic pain patients just want to get some sort of relief. And if we can give them long-lasting relief, their life will be fully changed.
Okay, really interesting stuff. I'd like to thank today's guest, Dr. Niteesh Bharara, physiatrist and director of regenerative medicine at Virginia Spine Institute. I'm your moderator, Nick Iannelli. For more on this discussion, visit WTOP.com and search Virginia Spine Institute.